And if you'd like to do something perhaps for yourself on Valentine's Day, why not consider a QLift? Now, I just found out that it is a non-invasive version, perhaps, of the facelift, and some local doctors actually put this procedure on the map. And they say that recently it's just seen an uptick because of the Zoom boom. You know, folks online meetings all the time, they're seeing their faces close up, and so they're reaching out to these doctors. Well, I, out of interest, reached out to these doctors to find out how it's done. Take a look at this.
Well, QLift is basically a facelift. About 15 years ago, facelifting became less invasive. And about that period of time, everyone sort of thought up a name for their facelift. So the QLift is basically a facelift that doesn't do it, that's not quite as invasive as the old way of doing it, with a name.
The QLift is something, you know, we've been in practice for many years. A QLift and a facelift, it's something that I always felt as a challenge. So we have done a lot of facelift. When you do a lot of facelift, as I said, experience is priceless. You always come across things that you think you can modify. Obviously, patients are looking into something that's going to improve their appearance, something that bothers them. But most patients looking into not spending so much time recovering from it. So I remember 15 years ago, we used to put everybody to sleep. They had to stay in the hospital overnight, and the recovery it's like 3 to 4 weeks. So as we went, we kind of modified how can we improve it to the point that patients don't have to be under general anesthesia. Patient can recover in a few days and go and do whatever they like to. So me and Dr. Rigan actually pioneered this procedure. I'm being very careful saying pioneering because a lot of surgeons modifying procedures when they do, and we actually kept on modifying the facelift, and in turn we called it a QLift. This procedure is very little downtime. We can do it under IV sedation. We do have a surgery center, Western New York of Surgery Center. Patient can have it under IV sedation. Rarely that we put anybody to sleep.
Can you talk about that, the difference between recovery times?
Well, as far as the procedure is concerned, the incision remains about the same. It's kind of a U-shaped incision around the ear, and then we lift the skin up to about the corner of the eye. And underneath that, there are structures that we actually tighten that give you the lift, both in the cheek and in the neck. And so we concentrate on those structures underneath. The difference between the new way and the old way was we used to lift the skin all the way to this nasolabial fold and all the way across under the neck, because people used to think you needed all that dissection to get the skin to redrape, but it's really not the case. So that's really the difference between the old and the new way. And I think that, and the new way is not all that new anymore, but we do absorbable sutures, we don't use drains. The procedure takes about an hour on each side. Most of them are done here in the office under local. You can still do it under general, but then you require an operating room, so that makes it more expensive.
I always said that this procedure, you need experience. And the experience that we have, me and Dr. Rigan, as I said, it's priceless. It really is priceless.